A traumatic injury usually occurs due to a fall or a force that is applied to the foot or ankle, resulting in bone or soft tissue damage. This can include sprain of ligaments, which means they got overstretched, tear of ligaments, which means they got broken, ruptures of tendons, which means the tendons got torn. Treatment of traumatic injuries can vary based on the extent of the damage. Some injuries may only require rest, ice, and elevation with compression. Other injuries may require immobilization with a walking boot or a non-weight bearing cast. Yet, more extensive traumatic injuries may require repair of tendons or repair of fractured bones with metal fixation. Whenever you have a traumatic injury, it's always best to see a surgical specialist. The specialist may need to order additional tests like an MRI or a CAT scan to further evaluate the injury. If a certain traumatic injury is not treated properly, there could be severe lingering pain to the area of injury for a long time. For example, a simple injury such as an acute ankle sprain can result in multiple recurrent sprains, including an unstable ankle over a period of time due to lack of adequate treatment at the time of injury. Having trained with one of the most renowned foot and ankle surgeons in New York City, I have extensive knowledge and experience in surgically treating foot and ankle injuries. So if you experience any traumatic injury to your leg, foot, or ankle, you should call us and come in to get evaluated for a proper treatment plan.